So I actually got involved last year. This is my second year going on the trip, and the PT program kindly offered this trip. One of our amazing professors, Don Roberts, decided to take us on this trip.
So it's a global health experience course which is designed as an elective for all graduate students in any health profession on campus. And part of that course is learning about global health, talking about health disparities. When I designed the course, or when we designed the course collectively, as a faculty, part of the course was doing some type of service experience. And for the past few years, that service experience in my course section has been in Haiti, working with a local clinician in Haiti who owns a rehabilitation clinic in the north of the country.
And every day it was basically the same routine. We would wake up, have our breakfast, we would walk to the clinic, FONHARE, in Ouanaminthe, Haiti, and we would spend 8 to 12 there. And then
the thing that will stick out the most to me was just being able to work with the PTs in Haiti and being able to like kind of co-treat the patients with each other. And so the first day we kind of just went to the clinic right away, and we were told to just grab a chart, grab a patient, and basically just assess what you could about them and whatever was wrong with them, whatever they needed help with. And we could kind of collaborate with each other and go off of each other, bounce ideas.
And when we got to the clinic, everything immediately clicked. It was amazing to see what the PTs do as compared to what the OTs do, but also how much overlap there are between the two professions and how you truly need both of these professions in rehab and not just one or the other.
There was a variety of patients. We saw a lot of stroke patients because unfortunately they don't have proper medication to treat high blood pressure there. So there's a lot of strokes that we saw. A fair amount of children around like birth to 5 years old, even upwards of 10, who actually had been there in previous years that the trip went on. So it was really cool for everyone else to see how much they progressed.
And going last year to this year, seeing a self-improvement in myself, to see how much more knowledge I've gained through Springfield College and the PT program, and actually see those skills like live time and right there in front of me with a patient was just amazing.
So this year we started a new section at Trinidad and Tobago. An alum from the class of 2005 MSPT at Springfield College, Carla Rossio, reached out to us to look at falls prevention. It was a great opportunity for me with my area of specialty in geriatrics to go and perform some falls screening out in Trinidad and Tobago. So the students and I were able to go out and do screening in 4 different areas of the country. Prior to the experience is they look at the country they're traveling to, they think about the different healthcare disparities that they might see, and we have them do a pre-assignment to kind of what they might see. And then they go on this experience, and we have debriefings every night in both trips. And then once they get back, they do a post-experience assignment to kind of see if what they thought would happen actually happened and how their opinions changed and how they see healthcare. And hopefully they'll come back with a new appreciation for how they can be part of the global society.
Because you go on these trips knowing that you're going to make an impact on the people that you see there. And after I went and came back and had a chance to debrief with the group that I was with and debrief with the therapists there and just reflect on the experience as a whole, I realized how much of a bigger impact that we truly had on the people in the country. We not only impacted the older adults that we saw and the people that we screened, but we had an impact on the therapists there. We actually heard back from a couple patients that they had already, before we even left the country, brought their information and their screenings to their local therapists and were asking for help. So just knowing that the awareness that we brought to them was already kicking in was huge. And then one patient in particular that I met with, he had a lot of understanding for his condition compared to other people in the community, and he was giving us all this knowledge about things that he knew about it, and we were comparing to what we knew, and we could share our information together. And before we left, he held us by the hand and said, "You guys are God sent. You are a miracle. It's unbelievable. We can't thank you enough for coming." So that just summarizes everyone that we met in a whole.